Well, good afternoon, everyone, and thank you for joining our regular 2:30 public update. Today, Dr. Ezike and I are joined by Illinois Department of Human Services Assistant Secretary of Programs, Kia Coleman, Special Assistant to the Director of our Department of Healthcare and Family Services, Kishana Loans, and Dr. John Vozinelik, Chief Medical Officer for Digital Health and Innovation at OSF Healthcare, to talk about our broader efforts during this crisis to protect the physical and mental health of communities throughout our state. This moment is understandably grueling in just about every aspect possible for so many people. We're all dealing with a new situation. In many instances, parents are working from home while also trying to teach their children or manage their e-learning and provide them with structured activities and stimulation. Other families who are unable to work are facing significant financial challenges as they try to provide for the basic needs of their loved ones. For those who have a family member affected and infected with COVID-19, there are the additional stressors of either quarantine or having a loved one hospitalized that they cannot interact with. Although there are reasons to see hope and a lot of examples of people helping one another, all of which should lift us up, there are also circumstances that may cause you to feel despair, to find yourself swimming in the stress and uncertainty of it all. First, I want to say to all of you, feel all of it. We are living in a deeply unprecedented moment, and holding the emotional ramifications of that inside will only be harder on you. It's okay to feel. And please know that you don't have to feel it all alone. I want you to know that we're here to help, and here's how. The Illinois Department of Human Services Mental Health Division has launched a free-of-charge emotional support text line for Illinoisans experiencing stress related to COVID-19. Call for calm. This isn't a crisis hotline, but a source of support. Once a resident texts the hotline, they receive a call from a caring counselor from a local community mental health center. Let them be a listening ear for the challenges that you are experiencing. If you would like to speak with a mental health professional, you can text TALK, T-A-L-K, to 552020. Again, text TALK to 552020. Or for Spanish language, you can text hablar, H-A-B-L-A-R, to the same number, 552020. Again, this service is free to use, and it's available to you no matter your personal circumstances, and you will remain completely anonymous. You can also access a wider array of supports using the same number from your mobile phone. You can text that number, 552020, with keywords such as unemployment or food or shelter, and you will receive information back to help you navigate getting assistance. My administration is here to serve you and to help see you through this time of crisis. This text line is just one more way that we can meet you where you're at. In a few moments, Assistant Secretary Kia Coleman will talk more about the many ways in which our Department of Human Services is working to strengthen mental health services throughout the state to make them more available to you in these trying times. There are many of you who may be saying to yourself, I'm taking all the right precautions, but what happens if I get symptoms? Where do I go? Who do I see? Well, I want to provide you with answers to that. From what we know so far, the vast majority of people who get COVID-19 are able to stay home and get better on your own without requiring hospitalization. But without some medical advice and guidance, the prospect of managing this illness at home may seem unnerving and truly daunting. That's why today I'm announcing a remote patient monitoring program specifically to serve those potentially infected with COVID-19 who will be able to recover from the safety of their homes. Through this program, health workers will digitally connect with you when you are experiencing COVID-19 symptoms, but do not require an emergency or inpatient care. Patients will receive daily virtual visits and receive wellness kits that include things like thermometers and pulse oximeters, blood pressure cuffs, and alcohol wipes. This program serves to reduce barriers to physical health and mental health services in all communities and income levels, especially underserved communities and those most at risk during this pandemic. And because patients are served in their home, this program will also help limit the spread of the virus and safeguard hospitals from being overwhelmed by keeping those who can recover at home staying at home. This new program is available for anyone and everyone in Southern Illinois and Central Illinois and will be available soon throughout Northern Illinois during this coming week. In Southern and Central Illinois, I'm incredibly proud that the Southern Illinois University School of Medicine is our partner, serving communities around Carbondale and Metro East, Quincy and Decatur and Springfield. The hotline for that program is 833-673-5669. Again, the hotline for those areas in Central and Southern Illinois is 833-673-5669. And that number will be live on Monday. I'm also deeply grateful to our partners at OSF Healthcare, which will serve Central and Northern Central Illinois communities such as Alton, Peoria, Champaign, Urbana, Monmouth, Ottawa, Bloomington, and Pontiac. The hotline for the Central Illinois program is 217-545-5100. That's 217-545-5100, and that hotline is available right now. Finally, I want to talk to you about our children. As we've seen, children are susceptible to COVID-19, but a high percentage are much less likely to suffer the more difficult physical effects of the virus, and for that we're all incredibly grateful. But no child has been spared the upheaval that COVID-19 has brought to their daily lives. I've heard from many parents who are concerned about how our children and adolescents are processing and managing what they're seeing and hearing and feeling about all of this. It's important that we engage our children in these discussions and make sure that they know we're thinking about them constantly. To begin to address this, I'm co-hosting a special event today with Lurie Children's Hospital for children's childhood resilience, the Illinois Children's Mental Health Partnership, and MICVA Challenge. At 5 p.m. today, I will be hosting a virtual town hall meeting for kids of all ages. It's being hosted on Facebook Live at the Lurie Children's Hospital's Facebook page. I'll repost the link on my Twitter and Facebook pages to help guide people to the site. I hope that kids from all across Illinois will join us there. Thank you, and I hope you're all finding some joy in this Easter weekend. I want to let you know that I will be holding my regular daily update tomorrow at 2:30 p.m., although it will be brief. In the interest of giving Dr. Ezike a happy Easter with her family, she will not be with me tomorrow and instead will rejoin us on Monday. And now I'd like to turn it over to the doctor for today's medical update. Dr. Ezike.